Okay, so we do have one more speaker that I'd like to introduce. We didn't know she was going to make it tonight. She did. She's very busy, but she's amazing. I heard her speak, I don't know, 10 years ago, maybe. But this is Dr. Pam Gronemeyer. She is a member of the PNHP, which is Physicians for a National Health Program. She's co-president of PNHP Illinois, the Southern Division, board member of Missourians for Single Payer, and vice president of the Illinois Single Payer Coalition Board. She is a board-certified anatomic and clinical pathologist. She received a bachelor's degree from Washington University in St. Louis, attended Tufts University School of Medicine, and completed her pathology residencies at New England Deaconess Hospital in Boston, Barnes Jewish Hospital of St. Louis, and St. Louis University Hospitals. Dr. Gronemeyer is the director and a woman small business owner of SEMC Pathology, LLC, in Highland, Illinois, a pathology business that provides services to 6 critical access hospitals, as we've learned about in Mr. James' talk, in southwestern Illinois, St. Joseph's Hospital in Highland, Redbud Regional Hospital in Redbud, Washington County Hospital in Nashville, Pinckneyville Community Hospital, Pinckneyville, Marshall Browning Hospital in DuQuoin, and Community Memorial Hospital in Staunton. She's actively involved in directing the Infection Control Committee in the hospitals, as well as working on quality assurance activities and advocating for patient safety. She believes health care is a human right and provides health care insurance to her employees and their dependents. She's an activist in her community and in the healthcare arena. And as the child of a late union laborer, she knows that our safety net is vital to the preservation of our democracy. So I think following Mr. James, she's going to have some good things to tell us. So, Dr. Gronemeyer.
Oh, I am also at El Dorado, Farrell and Adel El Dorado, and Hardin, which is down by in Belclair. Okay, no, I'm a good to follow him because I am a physician for a national health program, and I believe Medicare for all will work. I mean, there are 18,000 of us people, our doctors and nurses and other healthcare providers who believe it will work. And we have a meeting every year in November where we talk about it. We just need to spread the word because people don't know what it means. You know, when you talk about single payer, Medicare for all, they don't realize that it will pay for itself. I mean, it will remove the insurance companies, but the insurance companies, they make money off of even administrative services. Medicare is administrated at like 2 to 3%. Insurance companies are probably 15 to 20%. So we can save money, and if you look, there's a bunch of articles about how we finance it, and also the Congressional Budget Office said it would work. So therefore, what we need to do is spread the word and explain it to people. So, okay, well, and I agree almost everything with Mr. James said. I'm going to start out with the problems with Medicare Advantage. Medicare Advantage looks wonderful because it has a low premium and sometimes no deductibles. And sometimes you don't have to pay anything for a premium, but believe me, it's not perfect. And most doctors would, I don't take Medicare Advantage because I don't think it doesn't work. Because first of all, the insurance companies are benefiting from Medicare Advantage. And they also make you have to have pre-approval, which means unlike Medicare, I don't know if you think that people love to go to the doctors, but I'm over 70, and I don't love to go to the doctors, and I don't think most Medicare recipients are just dying to go to the doctor. So I don't think we overutilize it. But Medicare Advantage you have to have a pre-approval. The way they rate people in Medicare Advantage is incredible. They go through your whole medical record, and they find any possible problems you might have had as a stub toe or whatever, and they add that to your risk. So by raising the risk of the person, they raise the amount of money they get every month because they're paid per capita. They're paid per capita so much per month for each of the patients. So, they're clearly, their idea, if you don't get health care, if you don't, they save the money. And that's the problem. They don't give the health care they need. You're fine if you're well, and it's a low premium, I agree, and that looks beautiful. But if you get sick, you don't get you may get denied your cancer care, you may get denied your surgery or whatever. And also it's telling that they don't use most of the
highly rated medical centers. I mean, you can't in New York City, you can't go to Sloan Kettering for cancer care because it's not on their providers list. I mean, they take it away from the centers of excellence. They don't contract with them. So therefore, you can't go to the places. You can't pick like Medicare. You can pick where you want to go, and it's not true that most doctors don't take Medicare. I mean, we realize that. I mean, I'm a physician. I'm a pathologist. I know there's not an unlimited amount of money to pay for medical care. So I have to make my prices. You know, I like he said, you set your price at something, knowing that what Medicare's rate is. And Medicare's rate doesn't change very much. And I mean, most insurance companies are based on Medicare rates. So the problem with Medicare Advantage is it sounds good, but it isn't good. And I mean, most doctors won't go on it. The other thing is if you go on Medicare Advantage and you want to drop it, if you want it, because what I do, I have I mean, it's costly because I have to have supplemental from Blue Cross Blue Shield. But when I went on to it immediately, when I was Medicare age, I didn't have to fill out any healthcare thing telling my problems. But if you drop Medicare Advantage and you go to conventional Medicare, you do. And then the insurance companies can deny you care or they rate you. So therefore, there are some reasons why not to do it. But Medicare works. I mean, I had bilateral mastectomies and cancer care, and I have my supplement, and it works. I mean, I didn't have any choice. I went to Barnes. I went to Siteman where I wanted to go. So Medicare, I mean, and this theory about turning everything to Medicare Advantage, the insurance companies are making off like bandits with Medicare Advantage. If you look at the profits, how much money they make off of Medicare Advantage, I mean, it's terrible. So therefore, we're negative Medicare Advantage, the Physicians for National Health Program. The second thing we're also negative is about the corporatization of medical, about how 60% of doctors are owned by corporations or hospitals. And that's dangerous because what happens is, even if they have an opinion about Medicare Advantage or Medicare for All, they can't express themselves because they'll be sat on by their employers. So therefore, you know, would like to keep as many doctors out of corporate medicine, I mean, as we could, because it's just not, we don't want doctors to be corporatists. The problem is that it's expensive to run a practice. So the next thing is about and I can't call it the one big beautiful bill. I have to call it the one big terrible bill. I mean, because it's terrible. I mean, it's cutting money out of, well, Medicaid. And then you talked about, and it is in the Kaiser, I like the Kaiser Family Foundation because they do give you a lot of good information. I mean, I look at face sheets from people who are on Medicaid. They don't not work. They work for fast foods. They work for a nursing home. They work for places that do not provide insurance. And I'm a small business owner. I have a private standing lab in Highland, Illinois, and I have 5 employees. My 5 employees cost me $6,600 a month for health care insurance because I pay all their premiums. And then we have as low a deductible as we can. If they go over over $500, I try to give them $500 more. So I think, you know, my employees are my best, you know, they make my business. So therefore, I think health care is important. But it's expensive, and it went up again, I think it went up 6% or something again because it keeps going up. So, I mean, it's not, I mean, if they cut everybody off of Medicaid, like they want to after the next election, or, well, they say by 2034 they're going to cut them all off. And, I mean, to believe that they're shiftless and lazy is baloney. And also, that stuff about, we know that people that are undocumented can't get health care, Medicaid. So that is just baloney. I mean, and they should be, you know, if their noses were growing, they wouldn't fit in the door. Because it's just, I mean, it's ridiculous. So we know that it doesn't make any sense. And now the other thing added on top of that is this ACA thing. And we don't know how many people are going to go off the ACA. I mean, people are predicting that their premiums are going to go up 600%, which is like terrible. So they're not going to have health insurance. And I mean, small businesses really cannot afford health insurance. I mean, it really takes me a lot. I mean, I tell people if I do private autopsies or whatever, I'm a pathologist, I do those to make money to pay for my employees' insurance. because I think it's a value for them to have health insurance because I want healthy employees. And I mean, also, we want healthy people in the country. So health care should be a human right, and we should all work for it, but we need to keep pushing and pushing. And I mean, I myself would like to see single-payer health care in my lifetime, but I think we should make it our moonshot. Kennedy made it a moonshot in the 60s that we would make it to the moon. Well, why can't we do this for people? I mean, would we join every other industrialized country in the world? I mean, not all of them have exactly Medicare for all. I mean, Germany has a different system. Canada does, but they do pay more taxes, but you get something for your taxes. I mean, in the way Medicare for all would work, you would pay an increase in your taxes, but that would cover what you're paying now for your copays and deductibles. I still believe I should pay my employer's tax, so I would pay that, but that would be a lot less than I'm paying now. And we would cut out the insurance companies. And, you know, it's ridiculous. I mean, no offense to the insurance companies. They don't add a whole hell of a lot. I mean, basically, they're to make money. And, I mean, now what's happening at some of the hospitals, United Healthcare has cut the fees so much that the hospitals want to drop them. So, I mean, it's like, and then, I mean, talking about rural hospitals, we don't know how many rural hospitals. I think they said like 9 rural hospitals could close in Illinois. And the 2 nearest ones are Benton and Hardin, which is in right on the the Illinois-Kentucky border. So they could close, but there were some more up north. But we can't afford to lose the rural hospitals because people will have to go a lot farther for their medical care. I mean, in those critical minutes when you have a heart attack, you need to get where you're going. I mean, they dropped OB because you have to have enough OB service to have 2 OBs. You can't have 1 OB because you have to have coverage. So that's partly why Redbud dropped them. You know, Redbud had an OB service, but it was they couldn't afford to have 2 providers. And you can't get like a per diem to come in every other week. So, I mean, rural hospitals and people in nursing homes, what's going to happen to them? I mean, what's going to happen? They're going to have to fall. Their families are going to have to take care of them. When when families take care of you, you have someone to take care of at home. You may have to give up your job. You have to provide. I mean, it's just ridiculous. Nursing homes will close and rural hospitals will close, and we can't afford to let that happen. And like I said, the ACA, that also is going to take money away from people who are now getting health insurance on the ACA, so that's going to drop the number of people also who are eligible or will go to rural hospitals. And rural hospitals do get, the problem with them is lots of the private insurance companies will pay rural hospitals less than they pay metropolitan hospitals, which is not good either. I mean, let's face it. And we know Medicare is set up to pay on your diagnosis. But in critical access hospitals, it's not set up on your diagnosis. It's set up on fee-for-service. So therefore, that's why they can function. But it's just going to, I mean, I can't even imagine the Armageddon. That's why I think we now should push for single payer. And Bernie pushed for it. And there are Republicans that, you know, there was an article in one of the cardiology journals about it. Cardiologists from Texas, I mean, and cardiologists are one of the big paid doctors. And he was for Medicare for all because he realized that's the only way to go. And, you know, as a doctor, we take an oath to do no harm. We're supposed to take care of people and try to make them well. Well, we can't make them well if they can't get in, or we can't get them into the hospital. We can't get them anywhere. So we are looking at an Armageddon. I mean, he's right. It's an Armageddon of what could happen. And I don't even know what's going to happen after this. How bad it's going to be with the ACA when they cut the subsidies out. And I mean, clearly they're not going to do anything about the subsidies. I mean, they've already said they're not. I mean, they said they would theoretically, the Republicans said they theoretically would rethink it, but I think they've already retracted that.
They'll have a vote.
And Trump thinks what we should do is give people money for their health care. It's like, what is he talking about? He doesn't have any idea. And, you know, that $50 billion that they put in the one terrible bill, that's not going to go very far, because that $50 billion for rural hospitals has to be divided by all the states and over so many years. So it's not going to amount to what they're losing now. So, I mean, we really are looking at a disaster. So we need to go to our congressmen, our senators, and, I'm mad at Durbin because he voted to give up the vote for the work for the ACA. But we need to push and push now. And I mean, if you want to look at a site, his Kaiser Family Foundation is great, but you can also go to the Physicians for National Health Program, which has a good website too and has information. And I mean, if anything that I can do, and that's why I came down here tonight, I was had to squeeze you guys in, but I think that we need, like I said, I wanted to make it my moonshot. That may sound like a wacko, but I remember we never got to the moon until after Kennedy made it our moonshot. So really, we should aim for it. And I mean, now is the time. If everything else is going to fall to pieces, we need to push it. So, anybody have any questions?
Question for you, the doctor, because we're talking about insurance company.
Uh-huh.
Can you give an estimate of the number of staff hours in your office that are devoted to processing insurance claims and arguing with insurance companies?
Well, I have a full-time biller, but she works 20 hours a week. And I'm a pathologist, and I have, I'm trying to think. I don't know. I mean, I probably have about 3,000 surgicals a year. So she's 20 hours a week. So that's pretty costly too. I mean, you don't have to call for me because I don't have to get pre-approval because I get the specimens when they're taken out in surgery, the doctor's office. But if you get pre-approval, I mean, I've heard of doctors calling for pre-approval and they told the guy he has the wrong number. So he has to call back again after. It's like, oh my, they do everything to try to discourage you from doing it. And the other thing is bad with Medicare. Medicare has an act called the Wiser Act. Now they want to start trying to have pre-approval for our Medicare claims, and they're going to use AI. Isn't that wonderful? Artificial intelligence. Doesn't that make you feel good that some machine's going to decide? I mean, right now, a lot of your decisions are made by nurses. You can't even get to a doctor to tell them. So therefore, AI, I can't even imagine. But they're going to try that, I think, in 5 states I saw that they were going to try it. But we don't know what, that because they're trying always to reduce Medicare. They want to, and Medicare works. Anybody who's on Medicare should tell people it works. I mean, that's the other thing, that people over 65 need to tell everybody how well it works.
I went to a doctor over in St. Louis. They have their own clinic there.
Mm-hmm.
And I had gotten the most exceptional feedback all the time, constantly, and care was wonderful from the nurses on up. Every time I went in there, everybody was happy, you could see. And I asked the nurse one time, why is everybody so happy here? And I mean, the doctor would always take time and come in and look and check my knees. I had my knees done and that. And they said was because these big businesses don't own us.
Right. Oh, right. Yeah, that's right. They don't want to be owned by corporations.
We are self-owned clinic here. And that is why. And so when he does his surgery and they said you have to have 15 minutes per each patient or whatever, he says, I take my time. And if they don't like it, it's their
Well, half
problem.
the time somebody is looking at the board to type in your stuff. And the other thing people have, this wonderful thing about the electronic medical record. You know why they wanted the electronic medical record? To capture all the billing. It's not really to make it any easier for people. It's so they capture all the billing. I mean, if you look at ER records, they charge by how many minutes of critical care they give. And the same thing in the hospitalists. They write at the bottom how many minutes they spend. As a pathologist, I have a published fee schedule. I mean, I'm not overly happy that they pay me $35 to diagnose cancer in a breast. And I would say it's harder because it took me a while to learn. And I tell people that the cells don't have C's on them, so I'll know they're cancer. Or they don't have M's. Well, no, I mean, I have to spend time. But what they did, they came up with a fee schedule that they they theoretically spend how much time you spend on it, how much expertise you need, and how much. There was another thing, I guess, that you did that was the feast that was that produced their billing, and it was like part of a PhD dissertation paper was how they arrived at it. But I mean, we have to have some way to set prices. So I mean, like I said, I know that there's not unlimited money. And I mean, it will be better if we do Medicare for all. But I encourage you guys to look at PNHP or to look under, like Gerald Friedman is a guy who wrote a lot of articles about how we fund Medicare for all. And Bernie Sanders had a lot of information about. I mean, it will work. I mean, if people weren't if they wouldn't keep telling us it's socialized medicine, and it's socialized medicine, no, it would get better quality and would get the friggin' insurance companies out of it. And I mean, I'm sorry to the insurance companies, but I don't think they add any great benefit.
As Americans, we get taught, we get told over and over and over again that we have the best healthcare in the world. We have the best.
He's right, 37th.
Yeah.
We're 37th.
Yeah, and when you look at the mortality rates for OBGYN, we're
Oh, it's
the
terrible.
worst in the world.
It's terrible.
It's like,
And this is the first time in like the last 3 years where our life expectancy has gone down, especially among people like the black population and among people that are poorer. It's gone down, but even among the regular people, it's gone down. So isn't it telling?
address that, but actually, black people, your life expectancy, depending on the zip code you live in,
Oh,
be-
determines it, right?
yeah.
Determines it. So yeah, no. If anybody have any questions, but yeah.
I saw or heard that the AMA has typically been against any type of single payer. Do you have any insight into that?
No, I wrote them, and I belong to the AMA. But I went to an AMA meeting, and there are a lot of people that are for it. But you've got so many doctors that are entrenched in what they believe in. It's like the Illinois Medical Society. It's like talking to a brick wall. What we need to do is find the people that want to push it, and a lot of the younger physicians do want to push it. So we need to, we need to keep harping on them, telling them why it makes sense, and they need to look at the data. I mean, we're not talking about them reducing how much money they make. And I mean, realistically, anybody who goes into medicine just purely to make money is wrong. I mean, it's not, you got to work hard, and it's not going to, I don't think you're going to be a billionaire. I mean, maybe a neurosurgeon is, but I don't think so. But it'd be pretty depressing to be a neurosurgeon. So, okay, thank you.
Thank you very much. All right. So we're going a little long. We got about 5 minutes till 9, and we'd like to get Julie up here to introduce herself. And then if anybody wants to stay for questions, we're happy to do that.